Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department. Let's talk about this pandemic. In today's video, new CDC guidance on face coverings is welcome news, but does it really change your decision about what you will do? So please share this with somebody you care about. This week, the CDC released new guidance advising that a fully vaccinated person can choose not to wear a face covering outdoors or indoors and does not need to maintain distancing. These recommendations follow the results of several studies demonstrating a less than 10% likelihood that a fully vaccinated person, if exposed, would carry virus and be contagious to others. We've been waiting for this data and we're hoping that this would be the case. It really makes a big difference. Combined with additional studies that document around 94% effectiveness for the vaccines, these studies speak to the low risk for those fully vaccinated for themselves and their risk to others. And that's how science works. Not one study or one result, but consistent results across multiple studies give greater confidence that the results are in fact accurate. But this guidance does not apply in all situations for all people, so it's important to understand where the guidance does apply. First, it does not apply to congregate settings, nursing homes, group homes, jails, healthcare institutions, places where close contact, easy spread, and high-risk people reside. Second, it does not apply to anyone not vaccinated. For you, the risk of contracting COVID and having a serious illness, long COVID, or even death has not changed. This guidance does not change anything for you. And if you live with someone who cannot get vaccinated, like someone on chemotherapy or who is allergic to a component of the vaccines, you pose a real risk to them if you get infected. You know, in Haywood County, 1 out of 15 residents have tested positive over the past year. Roughly 1 out of 8 unvaccinated people will get infected over the next year. So let's say you have been fully vaccinated. If you take 20 unvaccinated people, exposed, infected, who got sick, at 95% effectiveness, if those 20 had been vaccinated, only 1 would have gotten sick. Your risk of getting infected is low if vaccinated, but it's not zero. So, do you follow the guidance and throw away your mask? No longer pay attention to distancing? Well, the answer is the same as it has been all along. It has not changed. It's a judgment about how comfortable you feel in a given situation. And it's about Swiss cheese. To all the measures that we know mitigate the risk of COVID, the vaccine has added a very thick slice with very few holes. And that's great news. But is that new slice thick enough that the other slices are no longer needed? And the key word, I think, in all this is the word congregate. Situations that not only refer to living situations, but also to any circumstance where people are in close contact for longer periods of time. Now, this could be an office setting. It could be a street festival or a music event where people are packed in shoulder to shoulder. Or a restaurant with close seating and poor ventilation. And being able to know if there are those present not vaccinated. So your decision is a judgment about how comfortable you feel. It's been that way all along, and it's still that way. Nothing about that has changed. For each one of us, here are the questions. What is the prevalence of disease in my community at this time? How comfortable do I feel in a given situation? And if you don't feel comfortable, what measures will help you reduce your risk to an acceptable level? And if you choose not to be vaccinated or can't be vaccinated or live with someone at high risk if they get infected, then you have also chosen to more carefully follow the public health protective measures to protect yourself and those you care about. In this case, the new guidance does not apply to you. So be well and be careful, especially right now.